Coronary artery disease is one of the common causes of heart attack. So we will discuss here about its symptoms, its causes and its risk factors. So coronary artery disease develops when your coronary arteries, the major blood vessels that supply your head blood, oxygen and nutrients, become damaged or diseased. Cholesterol containing deposit, plaque in your arteries and inflammation are usually to blame for coronary artery diseases. When the plaque builds up, they narrow your arteries, decreasing blood flow to your head. Eventually, the decreased blood flow may cause chest pain, angina, shortness of breath, or other coronary artery disease signs and symptoms. A complete blockage can cause a heart attack. Because coronary artery disease often develops over decades, it can go unnoticed until you have a heart attack. But there is plenty you can do to prevent and treat coronary artery disease. Start by committing to a healthy lifestyle. Its causes: coronary artery disease is thought to begin with damage or injury to the inner layer of a coronary artery, sometimes as early as childhood. The damage may be caused by various factors including smoking, high blood pressure, high cholesterol, diabetes or insulin resistance. Radiation therapy to the chest is used for certain types of cancer. Sedentary lifestyle. Once the inner wall of an artery is damaged, fatty deposit plaques made of cholesterol and other cellular waste products tend to accumulate at the site of injury in a process called atherosclerosis. If the surface of these plaques break or rupture, blood cells called platelets will clump at the site to try to repair the artery. This clump can block the artery, leading to a heart attack. Risk factors. Risk factors for coronary artery disease include age. Simply getting older increases your risk of damaged and narrowed arteries. Sex. Men are generally at greater risk of coronary artery disease. However, the risk for women increases after menopause. Family history. Family history of heart disease is associated with a higher risk of coronary artery disease, especially if a close relative develops heart disease at an early age. Your risk is higher if your father or a brother was diagnosed with heart disease before age 55 or your mother or a sister developed it before age 65. Smoking. Nicotine constricts your blood vessels and carbon monoxide can damage their inner linings, making them more susceptible to atherosclerosis. The incidence of heart attack in women who smoke at least 20 cigarettes a day is 6 times that of women who have never smoked. For men who smoke, the incidence is triple that of non-smokers. High blood pressure. Uncontrolled high blood pressure can result in hardening and thickening of your arteries, narrowing the channel through which blood can flow. High blood cholesterol levels. High levels of cholesterol in your blood can increase the risk of formation of plaque and atherosclerosis. High cholesterol can be caused by a high level of low-density lipoprotein (LDL), known as the bad cholesterol. A low level of high-density lipoprotein, known as the good cholesterol, also can promote the atherosclerosis. Obesity. Excess weight typically worsens other risk factors. Physical inactivity. Lack of exercise also is associated with coronary artery disease and some of its risk factors as well. High stress. Unrelieved stress in your life may damage your arteries as well as worsen other risk factors for coronary artery diseases. Sleep apnea. This disorder causes you to repeatedly stop and start breathing while you are sleeping. Sudden drops in blood oxygen levels that occur during sleep apnea increase blood pressure and strain the cardiovascular system, possibly leading to coronary artery disease. C-reactive protein. C-reactive protein is known as CRP. The normal protein that appears in higher amount when there is swelling somewhere in your body. High CRP levels may be a risk factor for heart disease. It's thought that as coronary artery narrow, you will have more CRP in your blood. High triglycerides. This is a type of fat lipid in your blood. High levels may raise the risk of coronary artery disease, especially for women. Homocysteine is an amino acid your body uses to make protein and to build and maintain tissue. But high levels of homocysteine may increase your risk of coronary artery disease. Lipoprotein. This substance forms when a low-density lipoprotein LDL particle attached to a specific protein, lipoprotein A, may disturb your body's ability to dissolve blood clots. High levels of lipoprotein may associate with an increased risk of cardiovascular disease, including coronary artery disease and heart attack. And its complications are chest pain, heart attack, heart failure, abnormal heart rhythm known as arrhythmia. For the treatment, lifestyle changes. Making a commitment to the following healthy lifestyle changes can go a long way toward promoting healthier arteries. Quiet smoking, eat healthy foods, exercise regularly, lose excess weight, reduce stress, and walk for 30 minutes daily. It will decrease your risk of this type of coronary artery disease. And exercising and being physical active not only decrease the risk of your heart disease but improve your digestive functions and other body functions. So be healthy. If you're not subscribe our channel for daily medical videos.